Sir, what is the position of heart disease in India? Cause, treatment.
It is actually coming at a very bad level because of the young people. When we see a lot of young people below 35, 30 years getting a heart attack, mainly because of the lifestyle diseases. A lot of families have diabetes, especially in Punjab, Haryana, Kerala, Tamil Nadu. So these are the four states where a lot of diabetic population is there. Number two, a lot of smokers, in the school children are getting into addiction and they get a lot of addicted to smoking and all. And the third thing is actually these people only go behind the junk foods and there is no exercise and all. So these factors will make all the young people to get heart attack at very, very young age, and moreover, and they actually don't follow the medications and the exercise, by which they're getting reblockage and they die at a young age, which is actually a terrific situation in the country. And as a chairman of the National Interventional Council of India, I know that it is a scene all over the India. 35% of the population of heart attack coming below the age of 40 years. That is I'm telling you about Punjab, Haryana, Kerala, Tamil Nadu. Situation is much bad because more young people getting heart attack. See, this is actually the global Kerala Indian national situation. But this is the patient with the heart attack. If they come to the hospital, the first thing is actually they should get a primary angioplasty or the block removal in 6 hours time. So anything which is happening when a patient comes to the hospital with a heart attack, if they are not attended by a doctor within that stipulated time, nearly 9% of the people can die. So the point actually is important. Patient with a chest pain, they should come to a hospital where there is a facility of angioplasty. Luckily in Haryana, through PPP model, we have created 4 centers in civil hospital, Panchkula, Ambala, Faridabad and Gurugram. And we are actually keeping cardiologists 24/7. If some cardiologist is not following the dictum, we are actually appointing more and more cardiologists to get the care for the young people and to get it exactly on time. See, actually Nambala is one of the center for us in a premium institute because we do a lot of patients every day. Nearly more than 3,000 patients coming to the hospital only for the cardiology purpose monthly. And we are doing angioplasty for nearly more than 2,500 angioplasty per annum. So we just wanted to increase the number to a very high level. Not for that, we care nearly 70% of the patients coming here are under the category of BPL, SCST, Ayushman Bharat. These patients are completely sponsored by the government. And we do at a cost less than 50% of all the government hospitals and 1/3 of the charge of the private hospitals. So even a paying patients can get an affordable treatment in this place. And actually our mortality is very low. We are actually giving a better care and we are actually adding myself. And actually even though I run centers in Kerala, so I decided to focus this place and now I took as a charge of HOD cardiology this place to make this center bigger and bigger. And our health minister has a plan of having a cardiac surgery setup in 6 months time so that we will be starting cardiac surgery in Nambala Civil Hospital. So I just require the cardiology department to grow in a different level with more cardiologists so that our cardiac surgery also will prosper and all the poor patients, especially the Ayushman Bharat patients, will get better care. And I have a plan of having a pediatric cardiology OPD also in another 3 months time, every month, once or twice, so that even a pediatric patient will get. So the next phase is actually after cardiac surgery, our plan is to start pediatric cardiology in this hospital so that we have to develop in subsequently. With that mission, I came here to start my work. Actually, I started my OPD 3 days back and I'm actually available. And we are starting OPD at 9 o'clock and procedures are actually this yesterday procedure went up to 10:30. Yesterday itself we have seen nearly 100 patients and more than 50 echo and more than 20 procedures, and Most important thing is even in odd time, that means beyond our working hours, actually beyond our night 8 o'clock to morning 9 o'clock, we have done 3 primary angioplasty yesterday itself. So that indicates patient flow is very good. We have to do some more work to improve the system, and that will make the Ambala people, especially for the civil hospital, to get a better name, and more, not only that, the poor people get the better care. That is my aim.
As far as the doctors and the machine, medical apparatus, equipments are concerned, where we stand?
So actually, we have the best cath lab in the world. We use a Philips cath lab, which is actually not every hospital. We actually name some of the top class hospitals in the country. They are also having the same facility, and we do calcium block removal by rotablation. We do 100% block. I personally do the maximum 100% block removal in the country, and I go and train minimum 9 medical colleges in India and 17 states in India, and I go to 17 countries around to train people. Actually, I personally feel that whenever I train people, when I train one person, that will reach up to 100 patients. So if I train 100 people, that reach up to 1 lakh population. So my aim is not to treat only the patients coming to me, to train cardiologists, and by which I can train the other people. Even the cardiologist who is staying here for some time, he is also trained by me. So many cardiologists are trained by me in and around India, and especially even up to Jammu and Kashmir. I am telling I am from Kerala. So from Kerala to Kashmir, I train multiple people. That is my ultimate aim.
Which age group, gender, as well as financial status people जो हार्ट में है तो ज़्यादा पेशेंट किस सेगमेंट से आते हैं?
So actually we thought earlier it is only for the high socio-economic status people get the heart attack. It is not true now, because it is actually the low socio-economic status and the middle level economic status also get the same event as, actually we calculated these things in every year in National Interventional Council program. So when we take the data, what we see is there is no difference in the economic status to make the heart disease different. Earlier we thought that the high economic status people will not do exercise, but you can see that even the film actors, politicians, bureaucrats, doctors, they do more exercise in the gym rather than the poor people only eat the food and less activity. So if you look at the exercise capacity and the food habits, they totally change. You can see the lean people who are coming from the high economic status people, with the people with the pot belly is coming from the low economic status. So that makes a difference. Second is actually the gender. You asked me. Female people are definitely having high incidence of heart attack nowadays. Earlier they were rejected by the family or even themselves. Now it is not the story. Even they themselves come forward, and the family also looking after them and getting the heart disease, and they are also treated. If you look at the population here, 35% of the people inside this center is female patients.
Next one is age group.
Age group is actually, I told you sir, below 20 years we seldom see heart attack, but beyond 20 years we see a lot of patients. And one interesting part is actually, earlier we don't see heart attack beyond 80 years, people don't survive. Now we see people at 90 years. I have done angioplasty for 97-year-old people, and actually we took a calculation of octogenarians, that means beyond 80 years. We have done a data of, even in my center in Kollam, we have done more than 80 years, 120 angioplasty just in 1 year time. That means our incidence is going up like anything, number one. Number two, they are cared by their own children. Number three, they have pension schemes. Number four, even they secure money for their health now, like Americans and Europeans. We are also growing up. So we are now, according to the Prime Minister, we are number one, number five. Number three, when you become number three, octogenarians number will become double or triple, and that is age no bar for the treatment.
Please share some personal achievements to us.
So actually, luckily, I was the first Keralite to become the National Interventional Council chairman for 2 years, 2022 and 23. I have done the best cardiology conference ever in the history of Cardiac Society of India National Interventional Council in Hyderabad and Ahmedabad. Number 3, I am the course director of the CTO program in India. Course director, CTO means chronic total occlusion, patients with 100% block. Those 100% block is the reason of people going to the bypass surgery. I seldom refer a patient for bypass surgery because I can do most of the cases. I am telling with confidence, and that is why people are calling me. Today morning the call came from the Premium Institute of Mumbai. Sir, can you come there for 2 days training? So that means people wanted to see the complex angioplasty done by me so that they can also learn out of it. So I am the course director of IJCTO. Number 3, actually, you maybe heard about Amrita Institute. That is actually, they have given a Master Operator Award in 2012 when one cardiologist died. Actually, they selected only one cardiologist so far as a Master Operator Award. That is, luckily came to me. Number 4 is actually, I did the Best Case Award in CTO, not only in India Live, also in the gym. There is a meeting happened in Italy. I got a training from interventional cardiology training I got from Italy. So these are all some of the things. And first cardiologist to start a cardiac center in any ESI hospital in India. That was in 2013. Still running for the last 10 years. The first cardiac center in public-private partnership model in any civil hospitals in India. That is actually in Haryana, which has happened. Ambala, Panchkula, Faridabad and Gurugram, which has never happened. We actually started a public-private partnership not only in Bihar, not only in Haryana, also in Uttarakhand now. In Uttarakhand, in Dehradun, we started a cardiac center. This is actually again our achievement. And I do angioplasty for patients with kidney diseases. So actually kidney diseases, nobody does angioplasty. Why? The contrast which is used for the kidney patients or the angiogram and angioplasty will damage the kidney. I do angioplasty without using contrast. And that is not done by the largest data in the world is with me, which is called zero contrast angioplasty. I give lectures in almost all conferences. I am also fed up in giving lectures because everybody will call me for that. And they will ignore my other skills. And they will tell, okay, zero contrast means you have to give to that. So zero contrast angioplasty maximum number in the world is done by me. And the maximum publication also done by me. So these are some of the specialities which I do. And the maximum left main angioplasty. That means main vessel block, which is actually having the largest data of 700 patients published in Indian Heart Journal, again by me. These are all not only by me. Luckily, I got a chance to do that. I was trained in Italy by a world-renowned interventional cardiologist, Dr. Imad Shaiban. We should actually acknowledge that this center, Ambala Civil Hospital, I brought him also to do cases just 1 year back. I have a huge plan of starting some training program in this institute every 3 months. I'm assuring you, we will have a training program in this place, which bringing nearly 25 to 30 cardiologists from all over India to show that a civil hospital can train people, and by which that will spread all over the country. And I have done once, now I'll continue to do that with the help of some of the international people.
Thank you so much.